The cholera outbreak in Lagos State has reached a critical stage, with the death toll rising to 24 and 35 confirmed cases. A staggering 417 cases are suspected across 20 local government areas of the state, indicating the urgent need for action. Providing crucial updates on the cholera outbreak, the State Commissioner for Health, Professor Akin Abayomi, confirmed the situation on his official handle on Friday morning. The update was sourced from the Lagos State Cholera Outbreak Situation Report as of 19th of June 2024. Abayomi's report underscores the importance of personal and environmental hygiene in preventing the spread of cholera. The report reveals 417 suspected cases, 35 confirmed cases, and 24 recorded deaths. Meanwhile, on Thursday, the Special Advisor to the Lagos State Governor on Health, Dr. Kemi Ogunyemi, announced an increase in the number of deaths to 21 as suspected cases rose to 401 across the state. He said Lagos Island, Kosofe, and Etiosa recorded the highest infection.
Generally, it was about a week ago, a few days ago, when we had the first case. At first, we didn't know it was cholera because most of the time patient presents to the hospital with normal symptoms of diarrhea, which is indicative of gastroenteritis. So some other times they could have vomiting as well, and we manage them as the normal gastroenteritis. So up until we take samples and run lab tests, then we're able to know the particular cause of the issue at the time. So when they came in, we had the first case. We thought it was the usual gastroenteritis, but before we know it, we started seeing series of cases, and in about a span of 12 hours, we're able to record several cases. Then we know there's a problem going on. So generally, cholera is a diarrheal disease, and the culprit involved is Vibrio cholerae. Most likely spread through water, spread through food, person to person, hand to mouth. The major, or the most possible cause or possible way by which this is spread is through poor hygiene. And we will note that generally the places affected are places close to all this riverside area, and that is because it is easily transmitted through water. So we started seeing the cases. We were worried, we were concerned. At the time, we were asking them their source of water for cooking, for use at home, where they get their food from. But these are the possible ways in which individuals could contract the disease condition. So we went ahead, we admitted the cases we saw, then we ensured, because the main goal of treatment is to stop the excessive diarrhea and the vomiting. And once that is stopped and the infection is taken care of, then the patient tends to resolve. But that is just based on the hospital care. So the most important one is the one done at the community level, which is to try and ensure that every possible means by which this disease spreads around is impeded, is stopped. So we try to counsel the relatives of the patient that comes in to watch out for the kind of water they use in cooking, kind of water they use for their normal household uses. We also counsel people to stop eating food outside, because all these local restaurants, we are not sure their mode of cooking, how hygienic their process is, where they get the water for cooking from. So we also counsel them to stop eating outside, ensure they use clean water for use, and try to present to the hospital as soon as possible when they notice any symptoms that is associated with cholera in general. I would say that had it been that there is a clean source of water for use at the community level, then it would have reduced the spread of the outbreak, because it's very unlikely for this to happen in areas that are, that have nice that has good water system, that people they are wealthy enough to be able to afford healthy lifestyle. These outbreak tends to occur more in slums, where people are not financially buoyant, when they lack access to good water. So if in any state or any city or town that the government refuses to produce the necessary source of clean water for use, it tends to there tends to be the possibility for this to happen. Yeah.